It's the 1st of December and it's World AIDS Day. I'm by the name Janet Shocks and I'm here to talk about HIV and AIDS in children. HIV first is human immune deficiency virus, while AIDS acquired immune deficiency syndrome. HIV damages the immune system and interferes with the body's ability to fight against diseases and infection. According to the United Nations of Children's Fund, UNICEF, about 45.7 million people are living with HIV worldwide in 2022, while 2.58 million children of the ages between 0 and 19 are living with the same condition. Each day in 2022, approximately 740 children become infected with HIV, and approximately 274 children die with HIV-related cases. Number of children with HIV ages 0 to 9 are about 930,000. Can you imagine such an outrageous number of children living with HIV? While adolescents from ages 10 to 19, there are about 1,650,000 people, children, adolescents of age 10 to 19 living with HIV and AIDS. Now, how can we get HIV? HIV can be spread through contact with infected blood, semen, vaginal discharge, illicit injection drug use, sharing of needles and other sharp objects, or from mother to child during pregnancy, childbirth, and breastfeeding. Signs in children: inadequate weight gain, pneumonia, skin disease, ear infection, diarrhea, swollen abdomen, fungal infection in the mouth, also known as oral thrusts. All these are signs of HIV in children. Now, let's talk about how HIV can be treated, which is one of the most important ways to avert such. Although HIV cannot be cured, but it can be managed, and the management of HIV can be done through the daily intake of antiretroviral drugs, which is the HIV drugs, also known as ACT. It can be gotten in the hospitals in Nigeria, across Nigeria, in any heart-to-heart center, any hospital with the logo of a heart-to-heart center. Such medications can be gotten and can be gotten for free. For babies who can't swallow pills, liquid drugs are provided for them. Treatment in children can be affected by several factors, including child growth and development. Because children grow at different rates and speed, treatment cannot be dosing of HIV drugs becomes a bit difficult. Now, it has to be done based on their body weight rather than their age, because they develop at different times. HIV treatment, it depends on the medication adherence. Now, what is medication adherence? That is the ability to stay religiously on drugs. It becomes very difficult in children to adhere to drugs due to several reasons and factors. Things like stigmatization from their friends. We all know that taking a retroviral drugs happens on a daily basis, and children with such issues become shy and begin to miss dosage because they don't want their friends to stigmatize them. Or children who are below age 5 who may not want to take the retroviral drugs because of its awful taste. Now, parents have to go extra mile to ensure that their children stay on the retroviral drugs for them to be able to live a normal, long, and healthy life. In the first year, it is quite difficult for doctors to recognize HIV in children. This is because diagnosis can only be made when two of such results shows positive. Prevention of HIV from parents to child. How to prevent it? Parents are advised to go for HIV test. Now I'm talking about both the father and the mother. They are expected to go for checkup, have a test, proper test, to ensure that no one of them is HIV positive before going into conception. For the parents who are already living with HIV, it is advisable that they stay on drugs, on their retroviral drugs, from the day one of pregnancy, all through pregnancy, and even during breastfeeding, because of the effectiveness to maintain a low viral load. And because of such medication, it is now safe for parents to be able to breastfeed their child, as the use of the retroviral drug has reduced the rate of a child getting HIV through breastfeeding to 1%, which is a good thing. Parents should go for tests during each pregnancy and in their third trimester. If detected that HIV is found, they should stay on the drugs to help avoid children from having HIV. Most pregnant people can have vaginal delivery except for people with high viral load during the time of delivery should opt for a cesarean section to reduce the risk of parental transmission. After birth, medicines should be received for the babies depending on other factors that determine how long and the dose they should take. So it is important, because we are trying to protect the child, for parents to help prevent HIV transmission from themselves to their children. It is very necessary for us to adhere to all these guidelines. And you could visit a doctor or any hospital to find out more about HIV and AIDS and how to prevent such transmission. We at Protect the Child Foundation, we care about the children, because children are the future of tomorrow and they are very important to us. So let's help our children live a normal, healthy, and beautiful life. Help spread the word. Help spread love. HIV is real. HIV is incurable. But HIV can be managed. Having HIV is not a death sentence. Having HIV does not mean that your life has stopped. Having HIV, you can have HIV and live a normal and healthy life. Just ensure that you go on the antiretroviral drugs, which is easy to get and it's even free in Nigeria. Do not be ashamed. For people who do not have HIV, please do not stigmatize people living with HIV. Let us try to show love to them. They are our brothers. HIV cannot be transmitted through our sweat, our saliva, our body fluids. So please do not stigmatize them. Let us encourage them so that we can save the next generation. We can have a next generation without HIV. Thank you.